Welcome to episode 3. Today we're going to talk about the leg, and we're going to start off with the gastroc, the gastrocnemius. For the proximal attachment of the lateral head, it's going to be the lateral aspect of the lateral condyle. For the proximal attachment of the medial head, it'll be the popliteal surface of the femur, superior to medial condyle. The distal attachment is going to be the posterior surface of the calcaneus via the Achilles tendon. The innervation will be the tibial nerve, S1, S2. The arterial blood supply will be our sural branch of the popliteal artery. And the action will be plantar flexes when the knee is extended, raises heel when walking, and flexes leg at knee joint. Next is our soleus. The proximal attachment of the soleus is the posterior aspect of the head and superior 1/4 posterior surface of fibula, the soleal line and medial third of medial border of tibia, and tendinous arch extending between bony attachments. The distal attachment is the posterior surface of the calcaneus via Achilles. The innervation is the tibial nerve, S1, S2. The blood supply is your popliteal artery, fibular artery, and posterior tibial artery. The action is that it plantar flexes your ankle and steadies leg on the foot. Next is our plantaris. The proximal attachment of the plantaris is the inferior end of lateral supracondylar line and the oblique popliteal. The distal attachment is the posterior surface of the calcaneus via the Achilles. The innervation is the tibial nerve, S1, S2, and the blood supply is the popliteal artery. The action is that it weakly assists the gastroc in plantar flexion of ankle. Next is our popliteus. The proximal attachment is the lateral surface of the lateral condyle of the femur and the lateral meniscus. The distal attachment is the posterior surface of the tibia, superior to the soleal line. The innervation is the tibial nerve, L4, S1. The blood supply is the popliteal artery. The action is that it unlocks the knee by rotating the femur on a fixed tibia. It medially rotates the tibia of the unplanted limb, and it weakly flexes the knee. Next, we have our flexor hallucis longus. The proximal attachment is the inferior 2/3 posterior surface of the fibula and the inferior interosseous membrane. The distal attachment is the base of the distal phalanx of the great toe. The innervation is the tibial nerve, S2, S3, and the blood supply will be your posterior tibial artery and your fibular artery. The action is that it flexes the great toe, weakly plantar flexes the ankle, and supports the medial longitudinal arch. Next, we have our flexor digitorum longus. The proximal attachment is the medial part of the posterior surface of the tibia, inferior to soleal line, and the broad tendon of the fibula. The distal attachment is the base of the distal phalanx of the lateral 4 digits. The innervation is the tibial nerve, S2, S3. The arterial blood supply is the posterior tibial artery. The action is that it flexes the lateral 4 digits, plantar flexes the ankle, and supports the longitudinal arch of the foot. Last but not least, for the posterior leg, is our tibialis posterior. The proximal attachment is the interosseous membrane, the posterior surface of tibia inferior to the soleal line, and the posterior surface of the fibula. The distal attachment is the tuberosity of the navicular, the cuneiform, the cuboid, the sustentaculum tali of the calcaneus, and the base of the second, third, and fourth metatarsals. The innervation is going to be the tibial nerve, L4, L5. The blood supply will be your posterior tibial artery, and your action is going to be that it plantar flexes your ankle and inverts your foot. Moving on to our anterior leg, we have our tibialis anterior. The proximal attachment is going to be the lateral condyle and superior half of the lateral surface of the tibia and interosseous membrane. The distal attachment is the medial and inferior surface of the medial cuneiform base of the first metatarsal. The innervation is the deep fibular nerve. The blood supply will be your anterior tibial artery and your dorsalis pedis artery. The action is that it dorsiflexes the ankle and inverts the foot. Next, we have extensor hallucis longus. The proximal attachment is the middle part of the anterior surface of the fibula and the interosseous membrane. The distal attachment is the dorsal aspect of the base of the distal phalanx of the great toe. The innervation is going to be your deep fibular nerve, L4, L5. The arterial blood supply is your anterior tibial artery and your fibular artery. The action is that it extends the great toe and dorsiflexes the ankle. Next, we have our extensor digitorum longus. The proximal attachment is the lateral condyle and superior 3/4 of the medial surface of the fibula and our interosseous membrane. The distal attachment is our middle, and distal phalanges of the lateral 4 digits. Our innervation is our deep fibular nerve, L4, L5. The blood supply is going to be our anterior tibialis artery and our fibular artery. The action is that it extends the lateral 4 digits and dorsiflexes the ankle. Last but not least, for the anterior leg, is our fibularis tertius. The proximal attachment for the fibularis tertius is the anterior surface of the fibula and interosseous membrane. The distal attachment will be the dorsum of the base of the fifth metatarsal. The innervation is going to be our deep fibular nerve, L4, L5. The arterial blood supply will be our anterior tibial artery and our dorsalis pedis artery. The action is that it dorsiflexes the ankle and aids in eversion of the foot. Moving on to our lateral leg, we have our fibularis longus. The proximal attachment of the fibularis longus is the head and superior 2/3 of the lateral surface of the fibula. The distal attachment will be the base of the first metatarsal and medial cuneiform. The innervation is the superficial fibular nerve, L5, S2. And the arterial blood supply will be our fibular artery. The action is that it everts the foot and weakly plantar flexes. Last, for our lateral leg, is the fibularis brevis. The proximal attachment of our fibularis brevis is the inferior 2/3 of the lateral surface of the fibula. The distal attachment is the dorsal surface of the tuberosity on the lateral side of the base of the fifth metatarsal. The innervation is the superficial fibular nerve, L5S2. The blood supply is the fibular artery, and the action is that it everts the foot and weakly plantar flexes. And that's going to be it for our leg.